the skull. Okay. Now, without the mandible. But one thing I ask you, the brain is within it. Now, the mind controls the brain or brain controls the mind? Who will answer this question? Riddle. I'll give him a chocolate. I don't know what will be the size of chocolate. The brain controls the mind or mind controls the brain? No, এটা থাকলো তোমরা বলবে আমাকে পরের দিন. Okay. Now, we exactly don't know what is working in my brain and what I am thinking, my mind. I'm here fully engaged, taking notes, seeing the tab, everything I'm doing it. But my thought and mind is in somewhere, একটা অন্য জগতে আছে. This is এই চিন্তাটা, এই ভাবনাটা, it is exclusively that the human beings have. আরেকটা কি, you are in this Gen X or Gen Z, whatever it is, Gen Z, হ্যাঁ, মাল্টিটাস্কিং, একসঙ্গে কথা বলছো, একসঙ্গে লিখছো, একসঙ্গে মোবাইল স্ক্রোল করছো, আবার কিছু কন্টেন্ট আছে যেটা নিয়ে ভাবছো. All the bones are separated. Okay, now you assemble them. You assemble them. That's why I prepared this slide, this thing, this PowerPoint presentation. Now see, this is the frontal bone. Frontal bone. Now this is the ethmoid, this is sphenoid. Now see, this is Crista Galli. Crista Galli over the falx cerebri. When the brain is separate, the meninges, that's falx cerebri. It will be attached here. Now it has to have an attachment, an anterior and posterior attachment. This now it becomes easy when you dismantle the bone and then you assemble it with the base of the skull. You take the base of the skull and you assemble them. Now you see, yeah, this is the frontal bone, this is sphenoid. This is sphenoid, wing-shaped bone. There are foraminas, fissures. Now all important structures, nerves, optic nerve. Then the pituitary, fossa for the pituitary is here. Okay. Now you see, again, this is the temporal bone. This is the sphenoid. This is the foramen magnum. This is the occipital bone. Now see, this is assembled here. This picture is taken from Magmin's Atlas. Magmin's Atlas. You download your tab or something, or if you have the book Atlas, then you can. It is in this form. See. Now. Now this is the posterior view. This is the internal view. Again, I am comparing it. Now the sphenoid, you see. This is the occipital bone. Now, it's there. Next, you will take it from the um, uh, department and see it next day. Now, this is a picture taken from my favorite book, one of the favorite books. This is the dorsum sella. This is superior orbital fissure. This is lacrimal in the frontal bone. Lacrimal gland is placed there, and the foramen rotundum, the Vesalian caniculus innominati, and foramen ovale, and foramen spinosum. Now you see the man is riding a horse. Okay. He put his hand in the optic canal. This is the foramen lacerum here. The carotid canal, the carotid artery goes here. This is the pterygoid canal. This is pterygoid canal. This is the seat, hot seat, like a jockey. And over there, the pituitary is lodged. Pituitary gland is there. Now, the two arms are signifying he puts it at the optic canal, he puts in. Okay. And now, superior orbital fissure, upper lateral part above the ring, orbital branch of the middle meningeal artery, first part of the maxillary artery, meningeal part, branch of the lacrimal artery, see lacrimal nerve, frontal nerve, this fifth nerve, ophthalmic nerve, trochlear nerve, fourth. Now the superior ophthalmic vein, the middle part through the ring, upper division of oculomotor nerve, B nasociliary nerve, lower division of oculomotor nerve, and abducent nerve. Lower medial part below the ring, inferior ophthalmic vein. Now the pictures, the orbital fissure and the nerves, all the names, it will be taught to you, the individual nerves will be taught to you. Now where it goes and where it passes and where it supplies, that you have to know. Now this is superior orbital fissure and its contents. Now see, this is the recurrent, this is superior orbital fissure. This is the ring, the optic canal here. Now levator palpebral superior is the muscle. The superior rectus, this superior oblique, this is the dural sheath, this is the optic nerve, second nerve. This is the optic canal. Optic nerve, ophthalmic artery, inferior rectus. This is the inferior rectus. And the lateral rectus, abducent nerve here supplies nasociliary nerve. The fourth nerve. This is the third nerve here, supplying the superior rectus. And your third nerve supplying the inferior rectus and the here. This key is superior, lateral, medial, inferior. Now your eye movements and these nerves control. You sing laterally like this, not without moving the neck, head. You want to see like this. I cannot do. But few people they can squint, put their this thing they concentrate, or sometimes they bring in the medial rectus. Medially this thing or laterally this thing. You tell them they will put up there. They practice, they exercise, they practice, and this is the picture every textbook has. In all Singhs, all Dattas, all Mitras, whoever is there. Now see, this is the superior orbital fissure. Now you see the superior orbital fissure is here. recurrent meningeal branch of the ophthalmic artery, lacrimal nerve, frontal nerve, trochlear nerve, superior ophthalmic vein, nasociliary nerve, abducent nerve, lateral rectus. Now you see the inferior ophthalmic vein and inferior rectus, ophthalmic artery, optic nerve, dural sheath, optic canal, superior oblique muscle, levator palpebral superior, superior rectus. This is the, in very short, it is not so short as I say, but I try to give you an idea, but you have to see it yourself. And today, you just main points, the superior orbital fissure, one content you read today, and the bones involved in it, the frontal bone and the temporal and the sphenoid. You please ভাঙবে না তাহলে আমার সেই লিভারটা যায়নি, মনে হলো আমারই লিভার গেছে, হ্যাঁ ভেঙে গেছে। টেম্পোরাল, you just pass down. This is the maxilla. This is original bones. Please handle with care.